Good morning students, how are you all? So today we are going to see about community nutrition program. Nutrition aspect in community is very important because nutrition is is an important aspect for all age group, and especially in the community they are in need of making them aware about the nutrition importance of nutritional foods. So we are going to see in this class about community nutrition program. Government of India initiated several large-scale supplementary feeding programs and programs aimed at overcoming specific deficiency diseases and combat malnutrition. Especially in the remote villages, we don't have much of nutritional deficiency cases in Kerala, but when we come across other states in our country, there are a lot of cases being notified with deficiency disorders, especially malnutrition. So why it is so? It is because the mothers, the family members are not aware of nutritional foods, so they are lacking nutritional foods for the babies. Similarly, sometimes because of poverty, they are unable to bear nutritious food to give to their children. So in that way also the children are landing up with malnutrition. So government understand the need to combat this nutrition. So in that way we have started this program. So these are the 7 sub programs coming under this community nutrition program. That is vitamin A deficiency prophylaxis program, prophylaxis against nutritional anemia, control of iodine deficiency disorders, special nutrition program, Balawadi nutrition program, ICDS program and midday meal program. So now we'll see first one, that is vitamin A prophylaxis program. So this program is mainly to control blindness. So vitamin A, we all know the major deficiency in your nutrition. First year you might have learned about these vitamins and its deficiency disorders and which are the foods that is rich in all these vitamins. So major deficiency disorder is blindness. You all know that about night blindness. So to prevent that, we are administering single massive dose of oil preparation of vitamin A containing 2 lakh international unit orally to all preschool children at 6 months interval and 1 lakh international unit to the children between 1 to 5 years. So this is being given continuously for the kids. So starting from 9 months till the child reaches 5 years. So total of 9 doses of vitamin A is being provided for the children to prevent blindness. And the program launched by Ministry of Health and Family Welfare in 1970. Next program, that is about prophylaxis against nutritional anemia, launched by Government of India. Here, this is another issue that is being prevalent in our country among the adolescents. That is anemia, because they are more focusing and they are more addicted to have bakery foods, and we can say it as junk foods. So these are the foods which is lacking 0% of iron content. So thereby the children and adolescents are being landing up with these anemia issues. So they are having something. When we go to community, we can see it very common that child says, or the children or the adolescent says, I am feeling hungry. Mother gives 10 rupees or 25 rupees for them, and they will go to nearby stationery shop and have some murk or have some lace packets or burger. A burger we won't get for 25 rupees, but in such kind of things, packet foods they are having it, and their stomach they feel free of hungry, so their stomach feel full. That is enough. So but they are not, even the mother or family members are not aware about that the child is eating a food which is non-healthy and which is not having any nutrition, which can lead to many other issues and health issues in future. So to make the public aware, similarly to combat this, we are providing iron and folic acid tablet to pregnant women and also young children, that is during 1 to 12 years of age. MCH centers, ICDS and PHC in rural areas are engaged in implementation of this program. So they are the stakeholders who is providing this program, that is MCH centers, ICDS and PHC are providing, helping in implementation of this program. Iron fortification of common salt also have been developed, that is being provided free of cost from the government to all the household, so that in that way also we are able to combat the anemia. Compared to previous era, now the statistics of anemia cases have declined to very large number. Still, and there are children who are completely addicted to junk foods. Still, last year also when we went to community, we could see the children and teenagers and adolescents are running behind the bakery foods and packet foods, having that in after coming from schools, or whenever they feel hungry, or sitting free, as a break, they take these packet foods and have it, which is not a healthy habit. Special nutrition program by the Ministry of Social Welfare started in 1970. Target group is under 5 pregnant ladies and nursing mothers, and this program is being implemented in urban slums, tribal areas and backward rural areas. Here, the supplementary food supplies, that is the 300 kilocalories and 10 to 12 gram of protein per child per day. So this is the nutritional supplement, and this is the calorie and protein intake which is needed and being supplemented per child per day, that is 300 kilocalories and 10 to 12 gram of protein is being provided for the target groups from the government free of cost. For the mothers, it is 500 kilocalories, 25 gram of protein for 300 days in a year. The program is merged with ICDS. Now the program is being merged with ICDS. Now presently, as I said, we don't have the special nutrition program. All these activities are being integrated in ICDS. We'll learn about ICDS program in detail. Coming to Balawadi Nutrition Program by the Ministry of Social Welfare, started in 1970. Target is 3 to 6 year kids in the rural areas. Program implemented through Balawadis and also provide primary education to the children. Food supplements provide 300 kilocalories and 10 gram of protein per child per day. So this is Balawadi Nutrition Program, and this is how the food is being calories and protein that is being supplied for the kids. Now let us see in detail about ICDS program. In 1975, by the Ministry of Social Welfare, this ICDS program is initiated. Target is preschool children below 16 years, adolescent girls, pregnant ladies and lactating mothers. Lactating mothers are the targets of the ICDS program. Coming to the activities, supplementary feeding, iron and folic acid distribution, vitamin A prophylaxis. Anganwadi workers deliver these services through through Anganwadi. These services are being provided. Work of Anganwadi worker is to supervised by Mukhya Sevikas. So the services that is being rendered through Anganwadi worker is being supervised by Mukhya Sevikas and field supervision by CDPO, that is Child Development Project Officer. Coming to the objectives, to improve the nutritional and health status of 0 to 6 years. So it's very important that preschool children must be taken care, because before going to school they seems to be very healthy. They should not have any deficiency disorders or malnutrition, because that will affect their education and their future health status. So to prevent that, we are initiated this to lay foundation for the development of the child, to decrease the mortality, morbidity and school dropout. To achieve an effective coordination of policy and implementation among various departments working for the promotion of child development, to enhance the capability of the mother and nutritional need of the child. So, we know that all the vulnerable groups are being brought under this ICDS. So not only the children up to 6 years are being taken care. Similarly, it is also important that pregnant ladies and lactating mothers are also being taken care. So that also being considered, and the activities are being implemented to take care of these lactating mothers and pregnant ladies' nutritional needs. Under this ICDH package, we have supplementary nutrition, nutritional health education, immunization, health checkup of the vulnerable group, non-formal preschool education. So these are the activities that is run under ICDS program through Anganwadis. So supplementary nutrition, each child less than 6 years supposed to have 500 kilocalories, 12 to 15 grams of protein, that is rupees 4 per child per day. So that is how it is being calculated. So 12 grams of protein is the requirement of under 5 children. Severely malnourished children, 800 kilocalories and 20 to 25 gram of protein is being provided. So how much rupees is being spent from the government for each child